It's time for the Well with Lexington Health Cancer Center. I'm joined here by Dr. Scott Graupner. How are you doing today?
I'm doing well. How about yourself?
Doing good. Thank you for being here.
Yeah, pleasure.
So to start off, Dr. Graupner, there is a social media trend called tanmaxxing, where people are going for longer to get a tan. They're trying to get the darkest, and they're not protecting their skin. Can you talk about why this should be avoided?
Yeah, sure. So tanning in general, especially either in the natural sun or in tanning beds, it's basically having damage to the outer layer of the skin. When that happens, your body produces melanin, which causes the skin to become darker. The more times you do that, and the repetitive nature of that can increase your risk for having mutations that lead to cancer and things like that, and also early skin aging, wrinkles and things like that as well.
And what would you say is the biggest misconception for people when it comes to tanning beds versus natural sun exposure?
Right. So tanning beds, I think there's a misconception that they're safer than natural sun exposure, which is not the case. So a lot of studies have shown the amount of UV radiation, which is the damaging part in sun exposure and anything else, is much higher, up to 4 times higher in tanning beds than noontime sun. So you're actually getting a lot more of that dangerous UV radiation from tanning beds than you are from naturally sunning there.
Can you go over some other types of skin cancers that people might not be aware of?
Yeah, sure. So in general, with tanning bed use, there's about a 30% increased risk for basal cell skin cancers, about a 70% increased risk for squamous cell skin cancers, and about a 60% increase for melanoma. All of them can spread. Melanoma is the most dangerous one that we look out for. It needs to be treated fast. Here at Lexington Oncology, we treat more advanced skin cancers. There's been a lot of new therapies, including immunotherapy, which kind of revolutionized the treatment for more advanced skin cancers.
And let's say there's someone out there and they've been tanning their whole life. How can they reduce their risk?
Yeah. So the first thing you can do is, use sun protective clothing, use SPF sunscreen 50 or above when you're out in the sun. Try to have sun breaks, things like that. For people who have professions where they have to work a lot in the sun, especially wearing that sun protective clothing and sunscreen is going to be important for you. And then getting, if you've had all of that sun exposure already, just getting, early detection. So seeing a dermatologist for a full body skin exam if you're high risk for skin cancers, especially if you've had a family history or personal history of skin cancer, and if you've had lots of sun exposure, lots of tanning bed use, it's probably a good time to go ahead and make an appointment there. Do self-checks and have family members or friends do checks on areas like your back where you can't see. But things that certainly would be concerning are like new moles, and especially moles that are asymmetric, meaning they're kind of bigger in one side than the other, ones that are raised, if you have a mole that's bleeding, itchy, things like that. If you have color changes, so certainly if the mole is getting blacker in color or changing in color, that can be a red flag sign for developing skin cancer as well. So if you have any of those signs, I'd make an appointment with either your general practitioner or a dermatologist.
Thank you so much for your time. We appreciate you.
Yep. No problem.
And to learn more about Lexington Health, you can scan that QR code on your screen right now.